Assalamualaikum dan selamat pagi kepada div-div kehormat dan juga para peserta yang berada bersama saya di sini. So, saya Siti Sajida daripada GlaxoSmithKline Malaysia. Hari ini saya, my session will be in English. So I would like to share with you on the prevalence of gingivitis and also a little bit touch on the dentin hypersensitivity. So let us take a look on the gum disease, the prevalence of gum disease. Okay, gum disease is a leading cause of the tooth loss affecting in the majority of the adults, and it is a treatable and reversible disease caused by plaques build-up. So patients often ignore the key signs of this gum disease, which is a bleeding gums. So they thought bleeding gum is normal in their routine, so they just ignore the signs. So don't let your patient ignore the red alert of bleeding gums. So according to the study that we have done, 1 out of 3 adults suffer from bleeding gums, and almost 50% of the sufferer of bleeding gums do nothing about it. Why? Maybe the lack of option, or maybe the lack of time to talk to the dentist, or the thought that the bleeding gums is normal when they brush. So how you can help your patient to prevent this disease from being progressive? So first, the role of dental professional, you need to identify the patient with bleeding gums and those who are at risk of periodontal disease. And then how you can help your patient to manage this disease. You need to educate the patient on effective plaque removal and also minimize the plaque retention. You can also counsel the patient on their daily habits or dietary, on their lifestyle risk factor. Okay, how you can help your patient to treat this type of disease, the gum disease, so you can recommend an oral health care regime to fight against the bleeding gums. Okay. So management and treatment of bleeding gums. So what dental professional can do? So first thing, you need to minimize the plaque retention. You can use professional prophylaxis to remove the remaining plaque and calculus. The first line treatment always is scaling. Okay, so regular visit to support the patient plaque control. And then the second part is patient education. Maybe you can advise your patient on the oral hygiene instruction, use a soft toothbrush, use a right toothpaste, brush twice daily, do not smoke, do not eat the sugary things. Okay, and you can advise the patient to use a specialized toothpaste and mouthwash, and use the interdental cleaning, and also on the lifestyle changes. So the role of sodium bicarbonate in gum health, it can reduce the plaques. How this sodium bicarbonate works, the high level of extra fine sodium bicarbonate help to physically displace dental plaque from the tooth surface, and also it can reduce the bond strength between the dental plaque bacteria and between the bacteria and the tooth surface. So with brushing with sodium bicarbonate toothpaste, it has been proven to remove more plaque compared to the non-sodium bicarbonate toothpaste. So introducing you, I think I'm sure everybody known about this product, which is Periodontax. So Periodontax is uniquely different from to a regular toothpaste because it contains sodium bicarbonate 67%. So this Periodontax toothpaste deliver a plaque removal and greater reduction in gingival bleeding and inflammation. So let's take a look on the study that we have done. So Periodontax can reduce 4 times better plaque removal compared to the regular toothpaste or non-sodium bicarbonate toothpaste. So the patient has to brush twice daily in order to get the optimum level. It also has a 50% greater reduction in bleeding gums over 24 weeks period of time compared to the regular toothpaste, non-sodium bicarbonate toothpaste. So it also can reduce the gingival inflammation by 34% compared to the regular toothpaste. So in the market, we have launched 2 new Periodontax flavor, which is Periodontax Herbal. So Periodontax Herbal contains ginger extract, mint, and bee balm for the fresh and clean sensation after brushing. Get your patient to try at least for 2 weeks, then they will acquire with the taste. Because parodontax is always associated with salts because it contains sodium bicarbonate. So we really need your recommendation to the patient. Get the patient to try at least for 2 weeks, they will acquire with the taste. And the second flavor that we have in the market right now is parodontax daily whitening. So it's not for whitening, but it helps the patient to restore the teeth to the natural whiteness by gently removing the surface stains. Also, get your patient try at least for 2 weeks so that they will acquire the taste. So to summarize what I have shared just now, so parodontax is a daily fluoride toothpaste that is clinically proven to fight against bleeding gums and also to improve gum health. Of course, the first line treatment is scaling, but this is at-home toothpaste for your patient to complement their daily routine. So parodontax also is proven to be 4 times more effective at reducing plaque compared to the non-sodium bicarbonate toothpaste. So that's all for parodontax. I will talk a bit more on the Sensodyne since all of you seeing a lot of patients having sensitive teeth. Okay, so Sensodyne has been in the market for 50 years. So just to share with you on what are the difference between Sensodyne that we have in the market. So let us take a look on the prevalence of dentin hypersensitivity first. As you can see from here, this is dentin hypersensitivity cycles. Once patient having a sensitive teeth, if they use a sensitive toothpaste, the sensitivity pain will relieve. However, if they switch to regular toothpaste, the sensitivity pain will come back. So how you can help your patient to break this cycle? So by using Sensodyne, it can provide the relief from dentin hypersensitivity, and also it can give a long-lasting protection against dentin hypersensitivity. So being expert in sensitivity, Sensodyne has been in the market for 50 over years. We do have a lot of clinical papers to support our findings and also to support our claims. We have also a different range of product to meet the different patient needs. Let us take a look deep on the approaches in relieving dentin hypersensitivity at home. So currently we have 2 approaches, which is the occluding the exposed dentin, and also we have potassium ion, which is depolarized the nerve. So as you can see from this image, so Sensodyne Rapid Relief contain potassium nitrate. Sensodyne Rapid Relief contains stannous fluoride. It can give a 60-second relief, and for repair and protect, it can build the reparative layer over the exposed dentin. We also have the additional toothpaste, which is a potassium range, which can give a different flavor to your patient. Okay, I'll explain further in the next slide. So for Sensodyne Repair and Protect, it contains novamine. Novamine is a calcium and phosphate technology. So it helps to build the hydroxyapatite-like layer over the exposed dentin and within the dentinal tubules. It also provides a long-lasting protections against the dentin hypersensitivity. As for Rapid Relief, like I mentioned before, it contains stannous fluoride and facilitating polymer. It can give a 60-second relief and provide a long-lasting protection by twice daily brushing, and also it creates acid-resistant occlusion. As for potassium nitrate formulation, so this is all the potassium nitrate toothpaste. It contains 5% potassium nitrate and also sodium fluoride. So it clinically proven relief from dentin hypersensitivity, and it has low to moderate abrasivity. And we have a different flavor to cater to different patient needs. So the latest technology that we have is Sensodyne Sensitivity and Gum, which is a dual relief toothpaste with stannous fluoride. So how does it help the patient? So Sensitivity and Gum occludes the dentinal tubules, and then it also can give a 60-second, it occludes the dentinal tubules, and it contains stannous iron, which can build the robust occluding layer on top of the tubules. So Sensodyne Sensitivity and Gum, it can give a 63% greater sensitivity sensitivity relief over 8 weeks of times. So we have to advise the patient to use it twice daily to see the effect and to get the optimum level of this toothpaste. So Sensodyne sensitivity and gum also has an antimicrobial properties. So as you can see here, the green color is the live bacteria and the red color shows the red bacteria. So it shows here Sensodyne sensitivity and gum helps to kill bacteria and have effective plaque control in terms of gums. So two condition and one specialist toothpaste. So Sensodyne and sensitivity and gum, it contains stannous fluoride, which can kill the bacteria and also reduce the sensitivity by occluding the dentinous tubules. So it helps the patient to relieve the sensitivity and manage a gum problem without the need to prioritize one. So being expert in sensitivity, we not only have a toothpaste, we also have a toothbrush to cater the patient needs. So this Sensodyne sensitivity and gum toothbrush is designed for people with sensitivity and gum problem. So it has 3 types of bristles for effective cleaning. It can reach 5 times better compared to the regular toothpaste and 38 deeper reach in between the teeth. It also has a compact head and also softer to the enamel. So this is Sensodyne Deep Clean. A lot of dentists and a lot of patients like it because it's a micro fine tapered bristles. The bristle is 0.02 mm. It's round-ended bristles and it can reach 25% better cleaning in between the teeth and 36 better reach in between the teeth. Okay. So to sum up what I've shared just now, Sensodyne has been in the market for 50 over years and we have a robust clinical paper to support our findings. And we have a different type of Sensodyne to cater the different patient needs. So that's all from my side. I hope that this session will benefit you and we'll be sending you the samples to each of your clinics. Hope you can recommend to your patient and educate your patient on the importance of taking care of their oral health care. Thank you so much.